Hello and welcome to Fueling the Future, Shaping the Next Generation of Eye Care Professionals. I'm Dr. Pete Kehoe, Vice President of Provider Relations at EyeMed. First of all, I want to thank the Vision Council and the Foundation for co-hosting this important conversation and extend my appreciation to our panel of industry leaders. But first, let's set the stage for today's discussion. First of all, the numbers are going to tell a very clear story. Demand for vision care is growing rapidly, but the supply of professionals isn't keeping pace. And it's not just a trend, it's actually a critical challenge that we face, especially with the aging population. When we invest in students, we invest in the future of vision care, whether that's students for optometry, students for opticianry, or students as technicians for our practices. It's that early exposure, the mentorship, the adaptive learning environments, which are very essential to building a strong, sustainable pipeline for the future. These efforts help position eye care as a meaningful and rewarding career path. And as an optometrist, I can't imagine any other career I could choose. The eye care landscape is evolving, though, from how we run our practices to how we deliver care. With the rapid advancements in technology and changing patient expectations, our roles are really more important than ever. You'll hear shortly how one organization is tackling these challenges in a way that's both innovative and future-focused. And why it really matters, as a healthy workforce pipeline is critical to ensuring access to care. And most importantly, with that aging population and increased demand, the need for qualified professionals has really never been greater. So let's take a moment and meet our panelists. Distinguished panel of industry leaders. Their names are well known in their fields, but I'm going to allow each of them to introduce themselves.
I'm Alysse. I'm the Vice President of Research and Insights at the Vision Council. I have the honor of being the only non-optometrist, I think, on today's panel. So my qualifications come from the research world. I've spent close to the last 5 years at the Vision Council, but have spent my career in research and data analysis. So sort of through and through data nerd who loves to sort of tell stories with data.
Okay, well, next up, let's talk to Dr. Howard Purcell, an icon in our profession.
Howard Purcell, I've had the honor and privilege of being president and CEO of New England College of Optometry in Boston for the past 7 years. I'm a second-generation graduate of the college. My dad went to NECO as well, and I've been so blessed in this profession to be able to have seen it from many different perspectives. I started in private practice with my father in South Florida, spent a short stint in academia at Nova Southeastern, and then 25 years in industry. I was part of the J&J family for almost 14 years and Essilor for about 10. So I really can't keep a job pretty much. Now, sounds that way, doesn't it? Now, I've had a chance to see this profession from so many different perspectives, and it is an amazing profession, and looking forward to the conversation. Thanks for allowing me the opportunity.
Well, thank you for being here, Howard. I know you and I have been around the world and we've shared the futuristic view, so you're the perfect person to have here. And next up is my dear friend from the West Coast, Dr. Mick Kling.
My name is Mick Kling. I'm a practicing optometrist in San Diego. I've got a multi-doctor, single location practice here that is part of what I do. But what I spend most of my time doing is I'm the Senior Director of Professional Development for Vision Source. For those that are not familiar with Vision Source, we're a network of independent optometrists. I'll share a little bit more about our history a little bit later. But for now, just really excited and happy to be here and really looking forward to this conversation. I think this topic is really something that needs to be discussed as a profession and industry.
Yeah, that's great. Thank you. Thanks, everyone, as panelists. And Alysse, why don't you kick us off with your data information, please?
Great. Yes, I would love to sort of set some context here for the rest of you and today's conversation. So every year, the Vision Council estimates the size of the optical industry. So this is from a report that we publish every January, reflecting back on the previous year. And this is a big industry. So when we combine all of the sort of markets together, so we're looking at exams, contact lenses, ophthalmic frames and lenses, as well as Plano sunglasses and readers. We're adding that up to $68.3 billion industry of combine of patient out-of-pocket spending and managed vision care reimbursement spending. And so that's coming from a variety of locations. We're looking at around just shy of 44,000 brick and mortar locations where you can get an eye exam or buy a prescription pair of glasses. And I think sort of most relevant for today's conversation, we're looking at, in terms of eye exams, last year a count of 117 million comprehensive eye exams for a result of just shy of $11 billion. So this is a big industry. There's lots of demand for these services, and I'll talk a little bit more about what that demand looked like from an exam perspective next. Here we're looking at from recent survey data. So at the Vision Council, we conduct surveys every month with a representative sample of US adults. We're talking to 4,000 US adults every month to learn about their eye care and their eyewear behaviors, habits, spending, etc. So when we look at that data from earlier this year, we're seeing that 62% of American adults, so almost 2/3, are telling us that they had an eye exam in the last year, with about 1 in 6 saying that their last eye exam was in the last 1 to 2 years, and about 1 in 5, or 22%, are saying that they have gone 2 years or more without an eye exam. So that is a lot of American adults who are, crossing the threshold of their local optometrist. And here, this is also coming from our consumer survey data, where we're able to understand the vision correction that people use. So this is tracking data back to the first quarter of 2022. And sort of we see these lines bounce around a little bit, but from our most recent quarter in Q1 of 2025, we see that 4/5 of American adults, or 81%, use vision correction, either prescription eyewear or reading glasses. And that we see about 70% using some form of Plano eyewear. So either like Plano blue light glasses, non-prescription reading glasses, or Plano sunglasses. And then this result has been pretty consistent over time. It has maybe gained a percentage or two probably over the last decade, where we're looking at the percentage of the population who wears prescription eyewear, and that is at 67%. So firmly 2/3 of American adults are using prescription eyewear, either contact lenses or glasses, and many of them use both. And then finally, 64% are saying that they wear either glasses only or prescription sunglasses. So this is sort of subtracting out the contact only wearers. And then we see about 2 in 5 people telling us that they only wear Plano eyewear. So sort of setting the stage about the kind of robust demand for the products that our industry produces. Next, here we're looking at data from the federal government. So this is data from 2023 from the Bureau of Labor Statistics, specifically with their data on optometrists. So we're seeing sort of, they collect this data through government surveys, and what they're calculating is an annual median wage of about $135,000. And then looking at the overall outlook, so what they're projecting over 2023 to 2033, so over that kind of 11-year time frame, they're looking at a 9% growth, which is faster than the growth that they're seeing across other occupations. So this is, one of the occupations that they're sort of tagging as growing more quickly than average, based on an aging population and sort of an increased need for these eye care services. I will say that the sort of graphics you're seeing on the right here are updated regularly and available as dashboards on our Vision Council Foundation website. And so if you wanted to sort of explore this data on your own, not only do we have optometrist data available here, but we also have optician data or other folks who work in an eye care practice if you wanted to go in and sort of explore some of that data on your own. And then next, one of the other pieces of data that the Vision Council collects regularly is perspectives from eye care providers who work in practices throughout the country. So we have a panel of eye care providers, sort of a research advisory panel, who help keep us in the loop about what's going on the ground in practices. So we asked this question of them earlier this year in 2025, asking about if they found there was a shortage of optometrists, sort of their perception of what the supply and demand for optometrists look like from their angle. And so we're asking a variety of folks who work in practices. Primarily optometrists are the ones who answer our surveys, but we also have opticians or optical or lab techs answering our questions, as well as sort of other practice professionals, maybe a practice manager or practice owner who doesn't fit into one of these other categories. But what we're seeing is that opticians are most likely to tell us that there's a shortage of optometrists, with more than 1 in 3. So 36% are saying there's a severe or extreme shortage of optometrists in their position, followed by the techs. So about 1 in 4, or 26%, are also citing this severe or extreme shortage. And then optometrists are sitting at about 1 in 5 optometrists are also agreeing that there is a shortage, severe or extreme, of optometrists, followed by sort of the other practice professionals at 18%. So sort of the headline here is that, folks who are really close to this work, who are regularly involved in interacting with optometrists or potentially also hiring optometrists for their practice, somewhere between 1 in 6 and 1 in 3 are agreeing that there is a severe or extreme shortage for these folks to hire. And then here we ask these same providers in the same survey to tell us in their own words about what are potential solutions to this perceived shortage. So what we're hearing here, we heard a variety of things that people told us, but topping the list is around sort of the availability of training and education opportunities to get folks into these fields. 26% cited an increase in pay or benefits. And then the third highest option here was around awareness. So having increasing awareness of careers in the optical industry. And I will note here that this is not necessarily specifically about the optometry shortage that was identified. This was asking about sort of any shortage in the industry, either opticians or optometrists, and this was asked of everyone in the survey. So these are kind of general perceptions about growing the optical industry, and where our respondents were telling us that there's maybe some room for growth in terms of getting more folks involved in this field.
Mick or Howard, do you have any
Yeah,
thoughts?
so first of all, Alysse, I just want to say thank you to the Vision Council. You guys bring so much amazing data to this industry. Candidly, I don't think we have enough, but you guys do a wonderful job of bringing great data. So just thanks to all our friends at the Vision Council and the foundation for the great work they do. Just a comment and a question, perhaps. One thing I found interesting in the data you just showed about whether professionals see the need and the lack of numbers. I'm curious a little bit, the 26%, I think it was somewhere around there, that optometrists who said we don't have an issue with it. Regionally, the information on where they are regionally would be really interesting, because if I'm in New York City, Miami, LA, big cities, I feel like I have optometrists everywhere around me. And yet when you start going out into more rural areas, and I think those points have been made and will be made, that's where additional challenges occur. So it'd be interesting to note whether there's some regional differences there. But my question for you was, you showed in the exam, the number of exams that you showed that 80% basically of people within 2 years are getting an eye exam. That's a really nice number. Do you know if that's trending upward? Has that been flat? Has that trended down? Just curious what that number means to us today.
Yeah, so I've looked at that number pretty regularly, trying to assess if there's increasing or decreasing sort of growth over time. And what I've seen since we've been collecting the data pretty consistently the last 3 years is that, well, it will bounce around a little bit from quarter to quarter. So it's helpful, like when I'm looking at the data, typically I'm looking at to see, like, in terms of real numbers of American adults, like how many people are going in each quarter to get an eye exam. We've seen just sort of incremental growth over time. So when we're looking over the last 3 years, I think we've seen maybe a 1 or 2% sort of sustained percent increase for those services. So 1 or 2% increase probably doesn't feel strong at the practice level, but sort of when we add them all up, that's millions of people more that are going in for these services regularly. So I think the demand is increasing, but it's not exponential. It's very incremental right now.
Thank you. Keep doing the good work you're doing.
Let me chime in, and then I do want to let Mick ask Alysse or comment as well. But this is a good point to put one of our dear friends in. Dr. Richard Edlow is kind of he's the optometrist data nerd. He's otherwise known as the eye economist. And he presented some data that I think actually fits exactly into what you were saying right there, Alysse. He presented it at the optometry's meeting, the AOA meeting, just a few weeks ago in Minneapolis. And one of the things that he talked about is that there is going to be this increasing demand for not only an annual routine exam of almost 1 million per year, there's going to be an increasing demand of almost 4 million medical eye visits per year going over the next years. So we absolutely are at a critical point here where we've got to have more providers being more efficient to be able to see more patients so they can actually deliver that great care. So to that point, Mick, any thoughts for Alysse's presentation?
Yeah, no, great data, Alysse, and I'll echo Howard's comments. Really appreciate you guys taking the effort to really collect that data, and I was really happy to hear that you guys are doing it consistently on an ongoing basis, because to take snapshots in time is one thing, but to really be looking at it from a trend line standpoint, I think is where the real value is. I just had one other comment that stuck with me, and Howard kind of addressed this as well, and it was a number of adults that have had an eye exam. And if you flip sort of the way he presented it, about 20 to 25% have not had an eye exam in the last 2 years. I was curious about that group of the population. And I know that younger individuals, typically, if they're asymptomatic, generally don't go in and get eye exams for sure. And also, we have a little bit of a disparity between what the American Academy of Ophthalmology recommends with exam frequency. And so there's actually a little bit of a messaging difference. And I was just curious if you had any comments or thoughts on that 20 or 25% that haven't been getting eye exams. Why not? What are maybe some of the drivers?
Yes, so we do ask that in our survey about why people haven't had an eye exam if they haven't had it recently. I will say, sort of, before I get to that data, I will also say that where we do see a strong difference for people who haven't had an eye exam in the last 24 months, it is nearly double for people who don't have managed vision care insurance. So we're seeing that from our Q1 data of 2025, we're seeing about 15% of American adults who do have managed vision care are saying that they're still not going in for an eye exam in the last 24 months. But when we look at the no managed vision care population, that's 33%. So I think having managed vision care is likely the biggest driver. Age does play a role, but it is not as big of a factor as managed vision care status is. And then when we ask folks about why they haven't had an eye exam. So we asked them if they haven't had an exam in the last 12 months. So we're getting a little bit more granular than the 24 months, but 46% of people are telling us they didn't get an eye exam because they don't have any vision issues. So I think that's speaking to sort of the age related potentially issues that we're seeing there. 31% are citing the cost of the exam. So again, that's where I think we see where managed vision care plays a role here in getting more people into an optometrist's office, because they're probably not as worried about the cost of an exam. And then we fall off from there a little bit, where we see 21% have no time for an exam, or that they don't like doctor's visits, or that insurance doesn't cover it, sort of are some other reasons that we have from folks. But it really is about not having issues, but also the cost and not having coverage for those exams.
Thank you.
Right.
That's
Mick,
great information.
yeah, and to kind of chime in on that, the time between exams on managed vision care is significantly shorter than it is for someone who does not have managed vision care as well. So getting them into the office is one thing, and then keeping them on a regular basis to make sure they stay healthy is really the key to driving those patients and inspiring better health. So. Well, let's take a turn. Howard, I think it's up to you. You are absolutely getting the first look at the future of the optometric profession as you in your role as the president and CEO of New England College of Optometry. So why don't you take it away?
Thank you very much, Dr. Kehoe. I appreciate that. I think I'd like to hear more from Alysse, to be honest. She's had so much great data and information, but I'm sure we'll come to more of that. But I guess I see my role today as giving you all a bit of a snapshot of what's going on in the world of academia and optometry. And I couldn't be any more proud and honored to be part of this group. I just want to start off by saying we have incredible faculty, incredible students. I say this all the time. If you have a bad day in optometry, come to a College of Optometry and spend a day, and you will be inspired. I get inspired every day by our faculty and our students. It's incredible. Now, that doesn't mean we're perfect, and I'm going to share where I think we are, but I want to preface everything I'm going to say by saying we have amazing people working in the academic side. I respect them immensely, and you should support them and help them and give them everything you can do to support the things that they're doing, because we all are impacted by the output from the schools and colleges of optometry, opticianry, technicianry, all of the programs that we have out there. That said, to me, it has become pretty clear in my 7 years here that there are really two key issues, and that is, to me, debt and applicant pool. We must continue to focus our attention on those two issues. And it's become front and center even more when the debt side, as a result of recent federal regulations now that are limiting the borrowing power of some of our students. So this is going to continue to be an issue. We have to address it, Pete. We will ultimately price ourselves out of the game if we don't continue to look at this as a key issue. And I'll talk about some things that are going on in that area in a moment. With that said, it's all about strengthening the pathway. It's all about, in my mind, increasing the awareness, because that's really at the root of it. So let me because when I came to this space, all of these acronyms, I wasn't completely comfortable with all of them. So just very quickly, I think it's important to understand that all these groups, ASCO, ACOE, National Board, ARBO, AOA, all play a role in where we are going in terms of the academic side of optometry. So that's just a reality. ASCO, the Association of Schools and Colleges of Optometry, I'm a board member of that group. Every dean or president of the schools and colleges sits at that table. It's a critically important group. I am among people who have dedicated their entire careers to this profession, just amazing people. And ASCO, if you want to talk to the deans and presidents, you have feedback, you have ideas, you love something, you hate something, whatever it may be, that is the group. We have a great leadership group there at ASCO. Our vice president, executive director is amazing and is very experienced. So that is a great place for feedback. ACOE is the accrediting body. If you're not as familiar, I wasn't as familiar with ACOE. So we have accreditors. All institutions of academia have accreditors. You have a regional accreditor, but then optometry has a specific optometry accreditor. That's ACOE. NBEO, I think most people are generally familiar with, which is our national board. ARBO are the boards of optometry, represent all the boards of optometry around the country. They're there to protect the public. And of course, the AOA does its usual amazing job in advocacy. But all of these groups contribute to decision-making and kind of directionally where we're going. And so it makes it a little squirrely at times, just being completely honest in everybody's input and trying to manage all of that and prepare our students for the future. So where are we today? I thought people might be interested in knowing this. So we've had the most applicants we've ever had in optometry. So last year was the most ever. This year we broke that record again. So that sounds really great. However, it's not enough. We are nowhere close to what we need to be. And the numbers speak for themselves. Look, I think you're looking at the slide here, total applicants approaching 3,000, but first year matriculant seats, we have almost 2,000, 1,900. So you can very quickly do the math. That's 1.5 applicants for seats. That is not where we need to be. So good news is it's now going in the right direction. We saw kind of a bottoming out about 5 years ago, 6 years ago. And now we've started to see it creep back up, but just not at the pace that we truly need. So what can we do? What are the key factors now in trying to attract the talent? And I'll say this first of all, because I'm asked this question all the time, kind of what is the main reason that students pick optometry? And I will tell you, it's because of you guys. It's because of our colleagues. It's because they've had an experience in one of your offices that has inspired them. And it's a wonderful opportunity. And we'll come back to that in a minute. So I mentioned debt as one of the key issues. Right now, the unique, perhaps unique opportunity we have is the supply and demand is working very much in the favor of our graduates. As you can see, the number of graduates is not growing as quickly as we need it. We could debate whether there's enough optometrists, not enough. I think we all agree regionally we have some challenges. And so supply and demand right now, our average graduate is walking out with 4 or 5 job opportunities when they leave. So how do we take full advantage of that? With federal loans now being a little more of a challenge, and just to be specific, for optometry school, just being very specific, you have a maximum of $200,000 debt that you can borrow. I should say the amount you can borrow. Optometry school today, tuition-wise, costs about $200,000, about $50,000 a year. So for living expenses, other things, these become a challenge. So at NECO, we decided to try to find ways that we could assist with that. And one of the ways is something called sponsored pathways. And the opportunity there is to ask our employers, those are private practitioners, those are groups like Vision Source who do an amazing job with this, in helping our students to offset their debt. If we have this supply and demand, and this only works when supply and demand is where it is right now, but because it is, and because on average, when you open up a professional optometry practice, and you're trying to grow that practice, you're losing $50,000 a month when you don't have an optometrist there. So it was a pretty easy sell to say to employers, what about helping out? What about paying for some of this debt these students are acquiring with a quid pro quo that they'll agree to work for you for a certain period of time? And again, Vision Source is a great example of this. We have many of these examples out there. And I thank the employers. I thank the people. We've now nine different organizations at NECO, including an opportunity for private solo practices to participate in this, are participating in sponsored pathways. It's making a difference. In my 7 years here, it's the first time I've ever had students come to my office and tell me, this has changed my life. The fact that I can have half the debt just has taken such a burden off of me and has made such a difference and actually opened up my opportunities. I can now look at independent practice or something of that nature in a more realistic way than I was able to do before. So we're really proud of Sponsored Pathways. It is now something that many of the schools are offering, but it's all about the employers, them understanding the challenges and the issues and stepping up and really helping to support it. But awareness is at the heart of it, and all of us can play a role in this. We know there's 30 states out there today that don't have a school or college of optometry. The awareness of optometry in those states is dramatically lower. So how do we make sure that awareness continues and everyone can play their role? When you have a young person sitting in your chair getting an eye exam and they're asking you questions, they're kind of intrigued by it, it's interesting to them. And you can tell, we've done hundreds and hundreds of eye exams. We know who those people are who are interested. Talk to them about optometry as a profession. Mention it. Well, I will say, mention it if you love optometry. Mention it if you've had a great experience in optometry, which I know is the case for most of us. So it's a wonderful opportunity to recruit right there. And ASCO actually has two programs. I'll kind of jump to the second one because that's the one I'm really talking about, called Eye Opener. And I would hope everyone listening to this who's an optometrist will sign up for Eye Opener. All it does is we match together students with practitioners. And I asked for the numbers from today. We have 235 doctors signed up for Eye Opener, which is okay. We have almost 900 students signed up for Eye Openers. So we need more docs. And the commitment is as simple as I'll talk to them on the phone to all the way to I'll invite them to my office to spend a half a day and see how it goes. You can decide how much you want to be engaged. But I would hope everyone would see the value in doing this. And it's the role you can each play in helping us with this challenge that we face, that Alysse has gone through, and I'm sure Mick is going to talk more about, and as well as you, Pete. So I think Eye Opener is a wonderful program. If you're interested, it's eyeopenersessions.org. Jump on there. It's really easy to sign up, and they'll match you together. And I would hope we'll see a big increase in people who are listening in. The other one is Optometry Gives Me Life that I just want to mention. That changed everything for us. When we started Optometry Gives Me Life, that campaign, we had sort of continued to see over the 4 or 5 years leading up to that a decrease in applicant pool. I'm not saying this was the only reason, but it was clearly a factor. In each year we've done Optometry Gives Me Life, it's increased. Thank you to the industry people who have supported that. We could not do it without you. But I do want people to know that the schools and colleges are invested in this too. That depending on the number of students you have, you pay a certain amount every year towards Optometry Gives Me Life. So it's not just we're going out to the industry and saying, please help us. We are doing that, but we're also all have skin in the game on this one. I will tell you, and I don't today speak on behalf of ASCO, I'm speaking on behalf of myself, but one thing I know I could speak on behalf of ASCO, and that is this is the most important project that ASCO has. Optometry Gives Me Life and the things that surround that, Eye Openers and others, are the way we're going to continue to increase the great, diverse candidates that we need and want coming into this profession. So
thanks, Howard. You always come with that fresh and very passionate perspective. So thank you so much. Mick, comments, questions?
Yeah, no, great information, Howard. I think as I was taking notes here, I was writing, where is this going? And I think this I was asking about was the cost of education. Do you just feel like it's going to continue to rise? Where do you see this ultimately heading?
Thank you for asking that. Because, first of all, sponsored pathways is one potential solution. But here, and this is my own thinking, but I do believe it's the way we're going to go. I don't believe the answer is to build more schools in every state and to have brick and mortar everywhere. I believe the answer is to take the incredible faculty and leadership that we have today. And it's hard to find people who want to be in academia, who are good leaders, and that we need more and more of those. But we have a core group right now that is incredibly strong. You know many of these people. How do we tap into that expertise and make it so that if you live in one of those 29 states, soon to be, that don't have a school, and you're entrenched in the community and you have a family, that you don't have to pack your bags and move somewhere, that we can deliver that education to you through a hybrid educational program. And every time I say this, I always have to qualify it by saying, this doesn't mean you're not going to see real live patients. What this means is that we can deliver the didactic education and find the best people around the country, the smartest people in academia, to bring that education to these other states, and have people be able to stay where they are, train where they are, and hopefully then once they're graduating, stay in those communities and serve those communities, because those tend to be a lot of our rural, underserved communities. I believe that will also impact cost, because if you can deliver education in that manner, you can pool your resources in a better way, you can begin to impact on the cost. But honestly, it is a really, really challenging issue because you want to pay your people. You want them to make a good living. You want them to be inspired to work in this environment. So where does that money come? It comes from the number one way you generate your dollars, and that is through tuition. So we have to change that a bit. But all right, I'll leave you with this thought. I think in the end, the answer is not to do it independently through the schools and colleges, to do it through AOA, to do it through all the different organizations I gave you, but it's to aggregate us together, to have the industry help. We cannot do it without the help of the industry. And I have often to be careful about that because I came from the industry. So there's sort of this feeling, well, of course, Howard thinks that he's an industry guy. No, I've saw it from the industry's perspective. I see it from the academic perspective. And I tell you that we can't do it independently. We have to do it together.
You've always thought out of the box, Howard, and I can encourage you to continue to do that. Alysse, any questions or thoughts for Howard?
Yeah, I thought it was so interesting, and as the requisite data person here, I'm going to ask you a data question. So I was heartened to see that your applicant pool has seen some growth recently, and I know that that's good news across the board, really, for everyone. Where are you, like, if you're thinking about the next 5 years or 10 years, like, what are you thinking? Do you think that that level of growth is going to continue?
It has to. It absolutely has to. I think we'll have to continue to brainstorm and figure out ways, but if it doesn't, this is not sustainable. What we have is not sustainable right now. So there are a lot of efforts, but Optometry Gives Me Life to me right now is one of the keys. But it's collaborative nature, put the resources together. That we haven't been able to do. And I'll be candid with you. Sometimes it's just we don't love the message. So let's be real. One of the messages that has resonated is work-life balance. But not everybody loves that message. Well, I don't want people coming in thinking that they only have to work 2 days a week. Listen, this is reality. My dad, God bless him, worked till the week before he passed away, loved optometry. He would have done it till the day before he passed away if he possibly could have. But that isn't the way it is today. We've learned from our parents and our grandparents that we should have a better work-life balance, and we need that. I believe we will see an increase. And to directly address your question, I think it will grow. The pace that it will grow will be dictated, in my opinion, by how willing we are to come together, to find a common ground we can all agree on, and to pool our resources.
Yeah, and I know that there have been a lot of conversations at the Vision Council, especially within our optical retail division, to try to bring all of these disparate entities together, sort of around this issue related to the supply of optometrists. So I think it's still in its growing stages too on the collaboration side of things. But I do think that there's increase of interest from industry to collaborate with colleges, to collaborate with these other institutions.
No doubt. I agree with you 100%. And, I think, look, I'll put in a little plug. I think the Vision Council's retreat, I am the only academic I think I've ever seen there. I would encourage my academic colleagues and leaders to show up at that meeting and to be part of what goes on there. We have to be part of the industry. Now, there's always been a little church and state kind of feeling there, and it has to be. The industry cannot dictate or influence what we do academically, but they can certainly impact on how we operate, on making us, giving us a little breathing room, finding ways to speak to all their customers about the importance of what we talked about, eye openers, Optometry Gives Me Life, those type of things. That's the grassroots way. But we will get there. I'm confident. This profession has always done it, has always stepped up, has always found a way to address the challenges and problems. And I have no doubt in this case, it will do the same.
Howard, I'm going to ask you, hopefully you put you on the spot. How many schools are there currently operating with students right now?
24.
24. And how many are in the pipeline?
3.
Yep. That's what I thought, and I just wanted everybody to kind of be aware. So assuming, let's say, 30 to 50 students per school, that's another at least 100 to 150 additional seats, correct? Which makes that applicant pool.
Yes, so we have to stop fishing in the same ponds, and that's why I say I think a hybrid OD approach. Let's go places where people don't see it as an option. If Mick has a family and he's living in one of those states, he is forced to say, I got to move my family, or I got to leave my family for 3 years. The 4th year, you're kind of traveling around, but that's not realistic. So we have a pool of amazing opportunity that we haven't really fished in, if you will. And I think we have to start finding ways, whether the hybrid OD, that's our approach, or others, we need to brainstorm, think about how do we get to those people. And I personally don't believe it's about building a school in every one of those states.
Howard, just a light bulb went off when you said that. It's something I hadn't thought about, which is it really is about the number of applicants, because building more schools is not necessarily the answer if you don't have the interested candidates to apply for the positions.
Thank you. And Mick, you know what happens, and I'm going to be honest, is this is an area we don't like to talk about, but you know the outcome of that. You're dipping, I'm sorry, deeper into the pool.
Yep.
And you can decide what you think the outcome of that is, but it's not good.
Right. Yeah. Well, let's go see how we can understand a little more about what Vision Source is doing. Mick, why don't you share with us a little bit some of the resources that Vision Source offers and how you see Vision Source helping with this definite need of more optometrists, more technicians, more opticians in the field.
Yeah, thanks again, Pete, for having us. And I really appreciate the opportunity to be able to speak to this topic really from a Vision Source perspective. And I just want to share with you a couple things that we've recognized, not surprisingly, some of the things that have already been addressed here, but then some of the solutions that we are looking at. And just to level set, if you're not familiar with who Vision Source is, we are a 35-year-old company started by an optometrist, built from the ground up. We have over 3,000 independently owned private practices within our network. And just to put that in perspective to some of the data that Alysse gave us, our organization generated in 2024 over 3 billion of that, 68 billion of the industry. So pretty big footprint in the industry. That gives us a lot of muscle. It gives us a lot of influence within the industry. And we see a lot of patients, obviously, out of these 3,000 locations. But what it also comes with is a lot of challenges that these 3,000 practices have. In the two main areas that I want to share with you, if you'll hit the next slide for me, the two areas that we are struggling with right now are with practice transitions and with placing associate doctors within the practices. And within the Vision Source ecosystem, we have an initiative called Vision Source Next, and it's a very broad term that we use that really encompasses what we call the entire practice life cycle. So that's all the way from education through graduation, getting your first job, buying your first practice, getting into practice ownership, expanding and growing, and then ultimately exiting out of practice ownership. And through that life cycle, we have programs to help support our members no matter where they are on that journey. And the two areas, as I mentioned, that really need a lot of our attention, that I personally work a lot with, are with the practice transitions and the placement of doctors. I'll speak first to the transition business. We have, at any given moment, 1 to 2% of our network of 3,000 are transitioning ownership. That means 30 to 50 of our practices are somewhere in the process of changing ownership. And many of these practice owners, unfortunately, are not very prepared for selling their practice. So there's a lot of education required around getting their practices ready to be sold. And so our role is to really help facilitate that conversation to make sure that those practices get transferred into what we believe is the best form of practice ownership, which is an independent private practice setting. Now, obviously, our profession is made up of all kinds of professionals in all kinds of different environments, and certainly everybody has the opportunity to pick where they want to land. We are just focused on, and our mission is really about supporting and preserving independent optometry. So those practices that are transitioning ownership, we really are trying to move those back into the next generation of practice ownership. We want to give those new young doctors the same opportunity that I was given when I've acquired 7 practices myself, and that many of my generation have been given and passed down, so that we can continue that strength of independent optometry. Through that, we have a program called the Next Fund program. And through the Next Fund program, we provide financial incentives to help transition a practice from private ownership into private ownership and retain them within the Vision Source network. And we do that not only with financial incentives, but we have all kinds of resources through lending partnerships and all kinds of tools to help that transition occur. That's a wildly successful program. We have dozens and dozens of practices that are participating in that program. And that's been really a wonderful and amazing program for us to develop over the last 4 or 5 years. The second program that I want to just speak to for a minute, Pete, is what we call the Associate Placement Program. And I want to give Howard a little bit of credit. A couple of years ago, he came to us and said, listen, we're creating these pathways and we want independent optometry in the conversation. And so very grateful for Howard to get that really initiated with us. And what has come of that is a program that we launched about a year ago where we have the ability to offer to our member practices the ability to support a associate that's joining the practice in up to $150,000 of student loan debt relief. We have placed many associates in the last year, many more than I would have thought we would have been able to place. We have over 100 member practices that are already approved for the program. They're in every state in the country. And we have several hundred young to be licensed, so students or newly licensed ODs that have entered their information into our database, raising their hand saying that I am open to this program and I'd like to be considered for this. We do not get into the weeds in the business of actual placement. What we're simply doing is matching candidates, OD candidates, with practices that are willing to participate in this program. And so we just serve as a facilitator of this program. In the Vision Source ecosystem, we have posted up on our job board, we have over 350 associate positions currently available. And I would bet we probably have double that across the network because many of our members have gotten frustrated because they posted their position all over the place and they're just not getting leads. And so we know the demand is there. And Howard spoke to this supply and demand issue. We are currently in a market that is absolutely in the benefit of an employed doctor. You can just pick your location. You can pick your state. You can even pick your program to help pay back your student loan debt. We've never been in a environment where there's so many different opportunities for young ODs coming out of school looking to be placed into a practice, whether that be independent optometry, if you want to go into the military, commercial setting, there are so many programs that are currently available. So those are just two programs that we're addressing: practice transitions, supporting independent practice, keeping those practices independent, and our associate placement program with our student loan debt relief. And if you'll hit the next slide for me. And then the last thing I want to speak to that Pete asked me just to address was really about what are we doing about this idea of onboarding and training. And, you know, we have some pretty robust educational programs for our members through the Business of Optometry program and Vision Source Learning, where we really lean heavy into training and encouraging our member practices to really become what I would call a little bit more sophisticated when it comes to onboarding and training. But we need to get more thoughtful about how we're investing in the onboarding process and training those that are joining our teams. And so we've really developed some great programs to help our members understand the importance of systematizing and building their practices around what we call systems and controls, instead of developing businesses around key employees who often ultimately leave the practice. And so I think these are important elements for making sure that when we do attract the right people, that we create environments that actually are able to develop them into their full potential. And that includes not just the onboarding process, but also what are we doing to actually make them better leaders? Not only our ODs, but all of the members on our teams. Like, what are we doing to maximize their potential, because every time we invest in more into our people, it just makes our businesses better and healthier. So really spending a lot of time thinking about how we can support our membership in those ways. So putting a bow on it, as we've said a couple times already, we've got to address the practice transition challenges. We've got to, we believe, keep these practices in independent ownership. Number two, we've got to place these associate doctors in. Through Howard's programs and some of these other programs that he's mentioned, we want to be there and provide that pathway for independent optometry so that we can also bring those associate doctors in and help them reduce that burden of student loan debt. And then finally, how do we figure out how to invest in our talent and continue to develop them more?
Thank you very much, Mick. Quick question. You mentioned, 300 plus opportunities. Howard had mentioned, regional. Can you kind of break it down to urban and rural? Is that where the challenges are coming into a little bit more?
Yeah, great question, Pete. So, what we've learned is that, and Howard has commented about this in the past. I've heard him say this, that, most of the students that join optometry school, they all want to be an independent practice. And then as they go through the journey, by the time they get to their fourth year, they feel so overwhelmed with student loan debt. I think a lot of them just take the best job they can get with the highest pay and the most benefits. And because of that, I think it drives people into more commercial opportunities, which tend to be more in rural setting. In urban settings. And that combined with what we find is that new graduates tend to not want to practice in the country. And by the way, they define the country as 20 minutes outside of St. Louis nowadays, right? So everybody wants to be in the city center areas. And so it has left this huge void in rural America. And so when we launched our placement program, we got flooded with our members that wanted to participate. And we first gave priority to our rural practices because that's where the biggest need was. We have members, and I'm not making this up, we have members that are booked out a year. So if you call their office today and ask for an appointment, they're scheduling for July of 2026. Not only is that an enormous lost opportunity for the practice financially, but it's pointing out there's a huge unmet demand for patient care. People just need services and they're not able to get it. And these are almost all in more rural parts of the country. So,
and typically in the rural areas, you can get on any medical panel and you can also practice to your highest scope much easier than you can in a more urban area like Howard mentioned. Howard, since he set you up, comments?
When we survey students first coming in, close to 3/4 of them say, I want to be in private practice when asked what type of practice you want to be in. A couple things, though, to note on that as asterisks, I will say, or additions. One, when asked to define what a private practice is, they struggle. And I found what's interesting, I could talk to 5 colleagues and get their opinion on what is private practice, and they're all a little bit different. So we shouldn't be surprised if people coming in new to the profession. But I think what it's about is decision-making, my own decision-making, living and dying by my decision-making, and not having anyone else really be telling me how to practice or what to do. I think it really comes down to a lot of that for the first year student. But there are 2 reasons in the end they don't typically go into an independent practice if they don't. Typically, it's 5 to 7 years in when they do, by the way. But one of the reasons they don't, you touched on, which is debt. But there's a second one. And that is I've never run a small business in my life, and I don't really know that I can do it or how to do it. I think that's one of the huge advantages of a group like Vision Source, or coming in with someone who's built this practice, who understands it. I learned that from my dad. From practicing with my dad, I learned so much about the business of optometry. So it's really 2 of those, and we have to address both of those for another discussion, but it's very hard for the schools and colleges to spend a ton of time on the business of optometry. So we have to find ways, I think, to solve that. But I guess I would throw a question back to you, since you asked me some good ones, Mick, is that how can we get more students, you think, to be interested and understand the value of an independent practice?
one of the courses that we have through Vision Source is a practice transition course. And it's one of the courses that I do. It's actually my favorite course that we put on. We do it a couple times a year in Houston. And we really just spend a whole day and teach young ODs how to buy practices. I do it in conjunction with a transaction attorney and a banker. And so we come at this from all angles, legal, valuation standpoint. And so just creating platforms of education. I was in Minneapolis for AOA, and they had a program for practice transitions, which I love to see that happen. But we have to do it sooner rather than later, and that is actually get into the schools while they're still there. I know it's a challenge because they're so distracted with trying to pass boards and get through their curriculum. But I feel like we have to get them while in school to give them the confidence that you can do this, that once you graduate, maybe you want to work for a year or two and cut your clinical teeth. That's great. But if you go down that pathway of a corporate job that you're maybe not excited about, you wake up one day and you've got a family, you've got some kids and a couple Tesla car payments and a mortgage, and then you say, man, I'm not in a position financially where I feel like I can leave. And those golden handcuffs, I think, are what also prevent people from getting in. So we've got to get there earlier. We've got to get education in the schools. And once they get out, as soon as possible, get them educated.
Probably the right time is the time after graduation, and sort of while they're dealing with going to what states they're going to go to, where they're going to get licensure, things like that, to have a 2-week course on the business of optometry. And I'd love to see a group like Vision Source and EyeMed and the Vision Council to come together and create something like that. We have the expertise out there. It's just a matter of coordinating. And I bet you'd get not only graduates right out of school, you'd probably get people within 5 years of graduation being very interested in something like that.
Thanks for the opportunity to ask a quick question here. I will say shout out to my optometrist who I go to. It's a Vision Source location of Chevy Chase Eye Care just outside of DC. I think that she's opened her practice probably sometime in the last 10 years. And I think that also generally Vision Source has sort of seen growth in its network. Relatively recently, I was looking at the Vision Monday Top 50 report, and Vision Source is usually at the top there. It looks like sort of grown by, I think, 14 locations or so year to year. And so a couple of questions there. One, like, do you see the Vision Source network continuing to grow over time? And then Howard brought this up a little bit too, but this is a question I get asked a lot too, so I'd be curious about your definition. Like, how do you define an independent location? What does that mean to you?
Yeah, so
You asked him that and not me.
Yeah, so I'll speak to the growth. Of course, growth is important in any business, and growth is a very front and center topic with the Vision Source leadership. We are always understanding the importance that we have to continue to grow. I'm not going to sugarcoat it and tell you that we don't have challenges. And part of the challenges is some of the things we've talked about today, which is less graduates are wanting to go into independent practice. Well, if your model is built around independent optometry, it makes it a little bit more difficult to resonate with that population. So growth is harder for sure than it used to be, but it is always front and center, and we're always optimistic and excited and proud to top that list every single year. I think we've done it 8, 9, 10 years in a row. And so we will continue to do that. The question of defining independent optometry is a great one because I actually, a couple of years ago, I was with a group of 6 colleagues, all what I would call private practice optometrists, and we were debating this topic. We said, what is independent practice? I was shocked at the debate, how heated it became actually, and how at the end of it, we actually didn't come to any conclusion of what the definition was, because it really is ambiguous. It's ambiguous. And I think Howard said it best from my perspective, which is having the autonomy to make your own decisions. In whatever environment that is, that feels independent to me.
what makes it a little more confusing, I think my colleagues would agree with this, is there are some who have tried to define it based on their business models, right? So one group says if you own your optical, you're an independent practitioner. And that complicates it now because, so we can imagine why a student coming into this profession for the first time might not understand it, but they're still predisposed to think it's the right way to go. So we have an opportunity for those of us passionate about independent practice. We have an opportunity there.
If you think about it, Mick, if there was a message that we could shout at the rooftops, would it be, if you think you want to be in private practice, join a private practice as an associate? If the answer is yes, can you confirm that the salaries, the wages, the benefits that are offered in most successful private practices are usually very competitive with the corporate offers that would be out there? Because I think that I've heard that as a misperception from many students. They believe they've got to take that corporate position because it's always going to be a better financial win, especially that first year or two. Comments?
Yeah, I will tell you from my experience, independent optometry generally pays as well as most of the corporate opportunities. Now, where sometimes there's a disparity comes with benefits. Like a larger corporation might be able to offer a deeper benefits package, and sometimes that's a deal breaker for some candidates and they can't decide. But from the compensation side, we have seen a shift from a per diem to a salaried to now a percentage of collections model, which has really kind of leveled the playing field a little bit, in my opinion, because a lot of private practices are paying eat what you kill model. And I think that's really made the independent environment as attractive. But I will say this, one of the great things about our associate placement program, and I didn't really think about this when we built the program, but actually about half of our members that are participating in the program are doing it because they're looking for a pathway to sell their practice. So they're enticing the candidate into say, hey, come in as an associate, but my real plan for you is that you're going to love it and this is going to be your pathway to ownership. So that's a sort of an added plus to the independent pathway for these student loan repayment programs. You could do these programs through a corporate environment, but you're certainly not going to end up owning the practice at the end. But if you do it through an independent practice channel, there's that pathway to ownership, and you can learn as you go. You can learn how to be a business owner along the process, and that can create a real advantage to going independent.
That's wonderful. Thank you. Let's kind of try to bring this home. I think I've got one slide that I want to just kind of talk about the value of managed vision care, both from the patient's perspective, but also as well as the providers. If you want to go to the next slide, one of the things that's very clear is that managed vision care absolutely increases or expands the access of care for our patients. For me, when I took the role at EyeMed, it was a real challenge for me to call them members because I'm a doctor, so they're actually my patients. But across all this diverse communities, we were at the Vision Source meeting, we were doing interviews, we heard story after story of patients who didn't have managed vision care. Now they have it. They come back and they see their providers and they find, life-threatening or sight-threatening diseases. So it really is critical to have managed vision care drive patients to our offices so that they can get the care that they need at the time that they need it. One of the other things reason that EyeMed is very engaged, not only with students, with staff members, but with the community at large, is really trying to make sure that we have that very robust network. We need to make sure that we have a network of providers that can really deliver the care that's needed. We've seen an expansion in Medicaid. We've seen an expansion in Medicare Advantage plans, as well as now we're diving into the med-surg side of things. So we need our providers to be able to practice at their highest level, and we need to make sure that the patients and those members are being treated at that level. It's been said, and I think it's practically every practice that I know when they open cold and when they're in a growth phase, they see managed vision care as a way to drive patients to their office. It could be considered one of the most, or the number one marketing expense, but on the other hand, it does deliver patients. And as Mick mentioned, we really need providers that are not booked out a year. So that's why we're doing this webinar today and why we're trying to engage in students, both at the student leadership level and Howard students coming to Vision Expo to see what's possible in the industry. The other thing that managed vision care does is it creates loyalty. The vast majority of patients return to the same provider, and they also purchase their products year after year from that same provider that did the exam. But the real reality is that when patients are and members are part of it, it really maintains this network of connection. And I like to say that we get to save sight and we get to save lives as eye care professionals. And I think making sure that that patient has easy access to care is really what it's all about. So let's kind of wrap this up a little bit, and we'll open it up for a second. But I think we're going to skip to the next slide because Howard mentioned the Eye Opener program. If you actually scan this QR code, it's going to take you to the Vision Council's foundation. It's going to give you links at the foundation's website that's going to allow you to access the things that are available. One of the things I didn't mention, one of the things that EyeMed is really excited to work with the Vision Council's foundation is on these EyeMed Vision curriculum kits. What this is really, I'll call them resources for providers and educators to go at the grade school level to get children interested in their eyes and eye care and potentially a career in eye care, whether that be as an optometrist, an optician, a technician. The bottom line is we want to try to increase the interest of eye care at the earliest possible level. And we're really proud of that from an EyeMed perspective. But with that, what I want to do is thank the panel and open it back up if there's any questions.
I just want to say thanks for, partnering with us on this program. It's always great to sort of have robust conversations like these to talk about some of the pressing issues in it. So really, want to thank all of you for your work regarding this, and especially EyeMed for partnering with the Vision Council Foundation to sort of, continue pushing this work forward. We know, from this discussion today that there's a lot of need here.
That's great. Howard?
Wow. Well, first of all, thank you as well. I admire what the Vision Council does and Vision Sources. The roles they play are so critically important in our profession. So very happy to be here with everybody. I think my message I'd leave you with is help us, please. We need your help individually. Each of you can do so much in the recruitment space or in the encouragement opportunity. Thank you. Appreciate the opportunity to participate.
Pete, thank you for inviting me. Alysse, for everything you guys do at the Vision Council. I think the thing that sort of I would leave you with is something actually Howard said, which is we need everybody. We need this entire organization. This is not, a private practice issue or a managed vision care issue or an education issue. This is an industry and a profession issue. And bringing all of us together, all the stakeholders together, is the way you solve these problems. And again, thank you guys for putting this platform together. Absolutely enjoyed the conversation.
Yeah. Well, thank you all as a panel. On behalf of EyeMed, I want to thank the Vision Council Foundation for allowing us to do this with you. From an EyeMed perspective, we are doing everything in our power, and we're open to suggestions on how we might be able to help continue to raise and elevate the level of eye care, the awareness of eye care. So thanks all for your time and being on this. Thank you.
Thank you.